guys, I hope you're doing well. Today I wanted to chat with you about one of the most commonly forgotten about hormones that I see in practice, and that is progesterone. So for those who don't know me, my name is Dr. Ina Lakshan. I'm a naturopathic doctor here at the Hormone Rebalance Center. So let's talk a little bit about this hormone and what this hormone is, and this hormone is progesterone, okay? Some of you may be thinking, what is progesterone anyway? So let me tell you a little bit about that first. Progesterone is a hormone that gets produced in the second part of our cycle, of our period, once a woman ovulates in preparation, preparing the endometrium for implantation and technically in preparation for conception. So one of the other really forgotten about roles and really important roles of progesterone in the body is not just fertility and kind of PMS and cycle regularity, but it's really to keep estrogen in check. So very commonly, some symptoms of low progesterone are actually quite similar to estrogen dominant symptoms, which is why a lot of women, especially when I see ones that I see in the office, tend to come in thinking it's all about estrogen, it's all elevated estrogen, when many times, in fact, it comes to be a low progesterone issue. So some of these symptoms include things like irregular periods, irregular bleeding, either too heavy or periods that are infrequent, things like fatigue, low libido, anxiety, sleeping problems, depression, weight gain are all symptoms of low progesterone. And in fact, as you can see, they're quite similar to the same symptoms that you would see someone with elevated estrogen, which is why it's all important to sometimes check what your progesterone levels are if you're unsure. So why would someone end up being progesterone deficient? So because we only produce progesterone when we ovulate, one of the most common causes for progesterone deficiency are lack of ovulation. That starts happening after the age of 35 when women don't ovulate with every cycle. And the other cause is generally if you're having problems with infrequent, irregular periods, you're not going to be producing progesterone every period in spite of producing estrogen, and you're going to end up having a gap between the two hormones, which is going to lead to certain symptoms that I've discussed. So let me give you a couple of tips for some ways to really support progesterone production and even boost it if needed. So certain vitamins like the B vitamins, vitamin C, and zinc are all really important for progesterone production. So you want to make sure that these are part of your regimen if you're trying to boost progesterone. One of my favorite herbs is actually called Vitex, which is also known as chasteberry. It's a herb that helps increase what's called luteinizing hormone, LH hormone in the brain, in order to stimulate your ovaries to be producing more progesterone. And it's a really good way to naturally sort of reset the system if your body is not producing enough of its own. The other major parts that play into progesterone production are actually stress. Cortisol, which is our stress hormone, uses up our progesterone stores in order to make more of it. So actually progesterone is the mother hormone from which many other hormones, including cortisol, are made. And if you're under a lot of chronic stress, your body's going to use up a lot of your progesterone stores for the sake of managing stress rather than fertility. So you're going to end up potentially being progesterone deficiency. So really taking good care of your adrenals and the body's stress response and keeping stress to a minimum as best you can is one strategy. And then lastly, if you're really quite low and perhaps you've tested your hormones and you're low and you're really quite symptomatic, you may certainly want to consider supplementing with a progesterone. I only recommend using bioidentical progesterone. We can prescribe it either in a cream form or in a suppository form, depending on what's appropriate for your needs and symptoms. And it could be really, some women feel really great in helping sleep, both regulate your periods, anxiety, and just a variety of other symptoms, and mitigating estrogen dominant symptoms, and in fact really protect them from those elevated estrogen levels that may be also part of their picture. So in fact, it's one of our most protective hormones and safer hormones to use if there's, if it's low in production. So here's just a couple of tips for you. If you have any questions, please reach out. Please share this video if you liked it, or if you have anybody you think that may benefit from it. Here at the Hormone Rebalance Center, we give patients a complimentary assessment to just discuss their hormone symptoms, discuss some testing options that may be available for them, and what kind of treatment options would be, specific for their case, based on what, results come up. So please reach out to us if you're interested here at the Hormone Rebalance Center. Nice to see you. Bye for now.